does innovation mean in the context of this discussion about privatization?
Well, innovation to me is why we have asked for the Ontario health teams to be brought up. We now have over 90% of the population in Ontario with an Ontario health team. That means they coordinate their care. Whether that's initial diagnosis, whether that's treatment, ultimately when you have that kind of innovation where all of the healthcare partners are working together, that's innovation and that's better patient care, which at the end of the day, I think we all want.
Minister, the OMA has proposed doing private surgical centers to get some surgeries out of hospitals. Is that something you're considering? Is that innovation you're looking at?
So as you know, the Shouldice Clinic has been doing hernia operations for many, many years in the province of Ontario. Those partnerships with healthcare providers already exist. I will reinforce again, in the province of Ontario, you use your OHIP card to access healthcare services, and that will continue.
But what about user fee?
Sorry, to follow up. It would be publicly paid but privately delivered surgeries. Is that
it would be funded by your OHIP card.
But it could be delivered more privately, the more private delivery, right?
You mean like dentists?
Yeah.
Like
we're asking
physiotherapists?
You, Minister, we're asking you. This is not your healthcare system. This is the healthcare system
Ontario's
of 15 million
healthcare
people
system.
in Ontario.
This
and
is
they're
Ontario's
looking for clarity
healthcare
from
system.
you on exactly what's happening. So can you give us examples?
We have a publicly funded Ontario healthcare system that will continue in the province of Ontario. It is a very strong model that has served us well. Having said that, I am not afraid of innovation. And we will continue to do that innovation. I gave you one example with the Ontario health teams. Sick Kids has done some innovative things that have actually made better care for the children in Ontario and, frankly, all of Canada. We've done that with partnerships with UHN. There are so many examples. The patch that allows people who have diabetes is now publicly funded through your Ontario OHIP card and the Ontario Health Benefits. Those are innovations that we have here in the province of Ontario, and I want to see those innovations continue because we have amazing people working in the healthcare system, and let's use those ideas to make sure that they provide better service for the province of Ontario. I don't want the status quo. The NDP can continue with the status quo. I'm going to continue to work with partners who have great ideas and move forward on those ideas.
Will there be more user fees, Minister?
No. So can I just clarify your dentist example? Because it occurs to me that's actually usually privately paid.
I'm sorry?
Dental care, as your example, is not usually actually publicly funded by the province for most people.
They're private practitioners.
And that's what you're opening the door to for surgeries as well? More surgeries as well?
They're private practitioners. In the province of Ontario, we use our OHIP card for publicly funded healthcare services. It is as simple as that.
We should
not be afraid of innovation. We've done it well in the province of Ontario, and I want to continue to encourage that innovation because it means at the end of the day, people are going to get better service. I don't want the status quo. I think that there are opportunities. We've already seen them very recently in the last number of years, through COVID, through pandemic, that when we empower our healthcare partners, when we empower the physicians, the doctors, the nurses, they come up with ideas that make better care for patients, and that's what I'm looking for.
We're going to take one more question, guys.
Hospital CEOs are paid a lot of money, Minister.
Minister, the fear out there is that people are going to have to pay one way or another out of their pocket, whether it's to speed up a knee replacement or get a knee replacement.
No, absolutely not.
So you're guaranteeing that?
Absolutely not. I've said in the House, no, we have a publicly funded OHIP supported system that will continue in the province of Ontario. Do not be afraid of innovation. Do not be afraid of new ways to approach things. Ontario health teams are a perfect example of how we have taken hospitals, home care, long-term care, and put them all together in these teams that are going to make better service and allow that patient who is frankly going through a very stressful time, not having to repeat their story to multiple agencies, to multiple specialists. They're going to have the opportunity to be the center of what should be primarily looking after their care. And that's what I want to see.
But Minister, how does
that's
that
the innovation I'm driving.
But Minister, how does that address your approach?
Thanks, everyone.